breast cancer affects men as well, and especially when it comes to men, it becomes very aggressive.
Now, this is a discussion that I know is important to everyone in this room, because we all want to live longer, but we want to do it in a way that is vibrant, where we get to experience every lengthened year of our lives in the best way possible. So we're excited to have you with us, Dr. Wissam, today to explore the intricate connections between aging and its implications for our health, as well as how early detection can help us to do that. It can be pivotal, really, in longevity and making sure that we live a long and healthy life. Now, let's start first by looking at the collaborative efforts that are being driven, the projects that are being data-driven in terms of longevity research at the American Hospital Dubai.
Right, thanks for the invitation. I know it's around lunchtime, so we'll make it simple and quick. Longevity is a very broad topic, and I've realized that we all have the same set of minds. We're all having the same aim and goals, trying to promote a longevity with a good health. So there is a lot of collaboration locally and internationally between AI technology, blockchains, and healthcare providers, trying to collaborate all those data and analyzing those data and trying to come up with a certain parameters to promote longevity. So on average, for the last 50 years, the human lifespan has gone from like 52 to about 72, according to the latest data. Now, this comes with the, due to the recent technologies, improvement in the medication and healthcare sector. But now the thing is, how can we improve this more? Each hospital in the States provide about 760 terabytes of raw data for the patients. And unfortunately, only 20% of those are utilized for research. Now, there are 3 pillars of all that project that needs to be collaborated internationally. First one is, how can we utilize those data, these massive data, into research? And this can be achieved with the help of AI, as been discussed earlier. The other one, how can we keep this data secured, not to get into the wrong hands? And this can be done with the blockchains to make sure that this data is secured and facilitate the patient consent in order to use this data for research. And the third pillar is to analyze this data into a application of like biomedical sciences. And that's actually how we can start analyzing these data in terms of like human genomes. And then this will tell us a lot of information about what we need to know about cancer to prevent it and to promote longevity.
And as you say, this is critical, looking at prevention. It is October. It is Pinktober, in fact. It's Breast Cancer Awareness Month. By the way, before we keep going with the discussion, who here thinks that breast cancer is just for women? Breast cancer awareness, hands up.
Excellent.
That's actually really good. I'm surprised by that, because Dr. Wissam, it's not just something that affects women.
No, breast cancer affects men as well, and we give a lot of talks about this, and especially when it comes to men, it becomes very aggressive. And it's really delayed treatment, because men don't think, oh yeah, well, breast cancer, that's for women. Oh, I've got a lump and it's fine. I've got plenty of patients who had the lump for months and they didn't get it checked. Oh, it's fine, it's just a bit of like a benign lumps, I get on with my life, and bang, it's cancer, it's aggressive, it's gone to the lymph node. So it's an October Pink Month, and we really need to raise awareness about breast cancer. And as Da Vinci said, simplicity is the ultimate sophistication. So I want things to be simple. I would like all the ladies to examine themselves once a month at day 7 of their period. Very simple. It takes 1 minute while they're in the shower, and I think 1 minute is not a lot. We spend hours on the mobile every day. So day 7 of the period, Lift the left arm, check it from out to in, check the lymph nodes under the armpit. Right side, under the armpit, bang, that's it. Looking for the 12 breast symptoms, and I call it the breast lemon. And I can look it up. If you just type breast lemon, it will give you all the cancer signs of the breast. That's number one. So checking yourself is very essential. Ladies from the age of 40, if they are reaching that age, they need to have an annual mammogram and ultrasound from that age of 40. Of course, if there is like a family history earlier, then yeah, they need to be checked with an ultrasound or MRI at the age of 30, for example.
That's just critical. It really is so important to make sure that we get on it. I have to say, as somebody who works in media, every October comes around and I do the interviews around breast cancer. So normally we're just so busy, we think, oh, I'll do it later, I'll do it later, I'll do it later. But then I was just like, okay, I've got to get it done. I'm past 40, let's do this. And it's interesting because they found calcifications, which is kind of like the beginnings of what could be cancer. And so, they did biopsies and that kind of thing. But tell us, how can that early detection affect outcomes for patients? What kind of a difference can it really make?
Well, that's a fantastic question, because we as surgeons, we like to operate, but the more you stay in this business, you start realizing that doing the least earlier, it has a much, much better outcome for the patient on the longer term. So doing a minimal invasive surgery, then the patient will get on with their life. They don't realize or feel that they are like disabled or get really affected by the breast cancer. So, and I always mention that early detection of breast cancer, the cure rate is 98%. If we detect the breast cancer late, the cure rate is 2%, and you do the math. Early detection, it doesn't mean that you have to be paranoid about checking your breasts. No, it's about doing your checks a year, doing your self-examination once a month, and keep up to date with your checks. People will do it for 1 year, and they forget about it for 3-4 years, and bang, then a cancer is there, and we don't want to reach that stage.
What are some of the misconceptions around prevention, Dr. Wissam?
Yeah, well, there's two major misconceptions that I want to make it clear to all the audiences. That doing a biopsy in the breast, that does not promote the cancer spread at all. We're not opening a Pandora box at all. So if you get a lump, you get a calcification, go and get it checked. Don't be in a denial phase. Don't be very scared about it. Breast cancer now is the highest number of cancer in the world. Every year there are millions of ladies are diagnosed with breast cancer, but luckily it's the most curable cancer in the world as well. We're not talking about pancreatic cancer or bowel cancer when by the time we know about it, it's a 6 months lifespan. No. Breast cancer, 10-year survival, if you detect it early, 10 years is 98%. So that's why I tell my patients. You get a lot of patients who comes very scared, very annoyed. I was getting, well, they found me, there's a lump there. I don't know about it. I'm happy to come in 6 months. I said, listen, you're worried. And to sleep 6 months with this in, you don't know what it is. If it's cancer, I need to know about it early. If it's not cancer, you need to have a nice sleep, not to have a sleepless night for 6 months. So in terms of prevention, again, let's keep it simple. Running a healthy lifestyle. So don't cut carbs too much. Don't cut sugar, but control your portion. Control your, what we call the BMI, the body mass index, because if you control that, then you control how much fat under the skin. And we all know that the main driven of breast cancer is the estrogen. Estrogen, when the ladies are having their periods, it comes from the ovaries. But when the ovary stops working after menopause, the estrogen starts to come from the fat under the skin. So by controlling your weight, indirectly, you're reducing the exposure to estrogen, which is causing about 90% of all the breast cancer that we see. People bark a lot about genetics and its relation to breast cancer. This is only about 5 to 10% of all the breast cancer that we see. 90% is a cell in the breast that decided to divide without any programming death. And this is how the cancer starts. Get a lot of ladies in clinics say, why me? I said, well, this is $8 trillion question. I wish I know the answer. We don't know that yet. We run a high-risk clinic. People have a strong family history. We get them to that clinic, analyze them, and do genetic tests. So we test about 71 genes, trying to see is there any gene mutation that can affect not only breast cancer, it can affect thyroid cancer and ovarian cancer, like BRCA1 and BRCA2 genes, and Luframini syndrome. So even when you get these genetic tests and they test negative, there is a very painful standard statement saying, although we test those genes, but that doesn't mean that you don't carry a gene that we don't know about. And that takes us back to AI, and it's analyzing of the whole human genomes and connecting that to biomedical research, trying to find that why all the ladies get breast cancer. I get ladies who are active, healthy, in their 30s, vegan, low BMI, trains every day, they get breast cancer. And ladies who's high BMI, smokers, don't look after their health, and they get breast cancer. Why is that happening? It's very difficult to analyze it. And we count on the AIs and all these new technologies to help.
Which really emphasizes your point to early prevention and making sure that you test yourself, you go and get your mammograms checked, because the risk factors are just not that clear for who is going to get it and who is not, as you say. But talk to us about the UAE. How does it compare to other countries in terms of rates of screening for breast cancer? And do you think we have enough public awareness around it here?
I think there's two sections on this question. First question is the UAE screening program, and this is on the way. And we are doing far better than, for example, in UK, where I was trained. So in UK, the screening program is still every 3 years, ladies from the age of 47 to 73 now, to do a 3-yearly mammogram. This is not enough. And according to a US research from San Antonio in the state, it has to be every year. So we're doing like triple the work that they're doing in UK, because that's an NHS, there's a lot of funding and politics getting into it. And now in the States as well, it's the standard is from the age of 40, they get a mammogram and get it checked. So we're doing far better than Europe and the States when it comes to screening. And we combine the mammogram and ultrasound, because I always say, they're looking at two different things. Mammogram, looking at early calcification. Ultrasound, looking at lumps that might not even be seen on the mammogram. And if we need to do more, we've got the new technologies for what we call the contrast-enhanced mammogram. We have the MRIs. So the facilities are there, and people's awareness are far much better than, let's say, 10 years ago. People are more educated, they want to look after their health, and they really want to promote longevity by detecting these cancers early.
Yeah, it's so critical. And so I'd love for you to kind of take us through what we can do, because longevity has become such a buzzword right now. Everybody wants to live longer, they want to live healthier, and be and stay as agile and as young as possible throughout that time. So what are some of the impactful things that we can do right now today?
Good, that's a great question again. So, exercise 10-15 minutes a day. Eat less. In terms of portion, not really what you eat. There's a lot of people doing intermittent fasting. Yeah, that can help. But if you really want to run a healthy life, you need to have a good breakfast, nice lunch, and a poor dinner. Check yourself. There's about 15 to 20 screening programs. We're not only talking about breast cancer. There is a cervical cancer, there is a bowel cancer, there is a prostate cancer. So just keep up to date. Now with the phone, this is like your secretary. So just put a note on your phone diary. Just tell you, okay, well, this year you need to do this. That month you need to do that. And run a healthy lifestyle. And longevity is not only to live longer, but it's to live longer, healthier. And that's the key to it.
One of the interesting things that we hear about a lot now, it's become a big trend, is fasting, intermittent fasting. How does that play a role in that? I know that you mentioned weight, and that's often a risk factor, not just for cancer, but for other diseases as well. Absolutely. And it's important to keep that in check. So talk to us about how that can impact too.
Well, intermittent fasting will start to reduce the insulin resistance in the body, and that's a very important factor, trying to regulate your weight and your the healing cells as well. So by doing any module of exercise or fasting or dieting in a reasonable way, of course, the key to implement any changes in your life is to do small changes. Big changes, everybody will be keen, enthusiastic, and then bang, after 2-3 weeks, adrenaline goes down, and then you go back to your bad habits. So smoking, alcohol, junk food, exercise, all these you can collaborate it in a small changes in your day. And then to carve a a very good habit in your body, that takes about 6 weeks. To get rid of a bad habit, that takes 3 months. So that's the way we approach it.
Interestingly, tomorrow is Mental Health Day across the world. Mental health, I think it's really important to highlight the fact that it has a profound impact on our physical health as well. So if that's not in check, it can actually affect us in incredible ways physically too. So talk to us about the importance of taking care of our mental health for our physical health.
Well, that's a critical and sensitive topic when it comes to breast cancer. Ladies who's got a breast cancer, recently diagnosed with breast cancer, they are kind of in denial. They don't want to know about it. And that creates a lot of fear and psychological stress. And we're trying to break down all those, the hidden gems for them. The reason why people get scared and anxious because of the fear of unknown, they don't know what's coming up. Okay, now I've got cancer, bang, why me? Am I gonna die? What's gonna happen to my career? What's gonna happen to my kids? So by starting to break down the whole journey, we tell them clearly, okay, yeah, you've got cancer, that journey is not very pleasant, but we're gonna keep you busy for the next few months. But after that, you get on with your life, you forget about it, you're only gonna come every 6 months to get checked. So, as I always say, as a surgeon, my work is only 50% surgery and 50% psychology, because we need to treat patients as a human being. They're not numbers. They have needs, they have fears, they have career, they have family. We need to address all these, and it's not a one person, it's the whole team. We got psychologists attached to the team, we got psychiatrists, we got nutritionists, we got plenty of people who are really attached to the breast care team at the American Hospital Dubai, trying to promote that whole package to make it easily accessible to patient and as nice as possible journey. It's
a holistic approach. And of course, as you say, it's critical that we know our own bodies. Definitely. That we're in touch with what's going on. And as soon as there's something that's not right, that we notice that and we do something about it without fear and going forward. I know our editor-in-chief, I love that at the beginning of the summit, in her opening speech, she said, we need an anti-stress summit. Cortisol Correct. Levels plays Absolutely. A huge role in this, doesn't it?
Absolutely, it is. It's stressful. Not even the ladies who get cancer. Ladies just coming to get checked, they are very stressed out because they're worried that, okay, 6 months ago I had that lump, they told me it's fine. But if it's growing or it's changing shape now, it might turn into a cancer. So again, for me, the take-home message from today is please check yourself once a month. And by checking yourself, you know exactly what to feel, and you're checking your breast 12 times a year. So if anything abnormal, you'll detect it early. Get checked annually, and then look after your health and live a happy life. That's all the take-home message for me.
Put it in your calendar and get it done. Dr. Wissam Ismail, consultant oncoplastic breast surgeon at the American Hospital Dubai. Thank you so much. Ladies and gentlemen, please thank Dr. Wissam.
Thank you for the invitation. Much appreciated.
Thank you.